Is now starting. All attendees are in listen-only mode.
Welcome, everyone, and thank you for joining us for another Central Drugs webinar. We appreciate that you've joined us and you're going to spend some time with us tonight. Tonight's topic is especially for men in honor of Men's Health Month this month in June. The 5 questions every man should ask their doctor about hormones and nutrition. And tonight we have a special speaker for our webinar. Dr. Nayan Patel is a recognized expert in clinical pharmacy. He's a frequent guest lecturer around the world on topics like bioidentical hormone replacement, menopause, andropause, and nutrition. In addition to all those accolades, he's also the owner and pharmacist in charge here at Central Drugs for our two locations in Southern California, in La Habra and Fullerton. And we're just really happy that he's been able to put this presentation together for you about hormones and nutrition specifically as they relate to the experiences that men are going through and what their bodies are going through. So, Dr. Patel, thank you for joining us. And I just want to remind everyone that if you have questions, go ahead and type in your questions in the chat box on the right side of your screen, and we'll try to get to all of those questions as either at the end or as Dr. Patel is making his presentations. So we'll do our best to answer all of them. All right, Dr. Patel, thanks for joining us.
Thank you, Mark. Appreciate it. Again, this is the month of June, Father's Day. It's dear to me, of course. I'm a father of 3 kids, and it's my honor and my pleasure to present this topic to you. It seems like Mark has done a great job and getting this word out to a lot of different people. We have 101 people registered for this webinar today, and on the list I have a lot of patients and few physicians that have registered for this class. So we welcome everybody, and we hope this is very informative and exciting as it is to me. A couple of things I'll let you know. If you make life extremely simple, it's manageable. If you make life extremely complicated, you'll keep on spinning your wheels for the rest of your life and try to figure out what went wrong. So my job today for every man out there is to try to help you. How can you make your life extremely simple? And that's the goal for the day. So first thing I want to ask you, what are the 5 questions? What are the 5 questions? Why do men need to test for hormone deficiency? God knows, everybody knows, men can never go to the doctor's office and tell them there's something wrong with me, especially when it comes to hormones and nutrition. So we need to figure out, why do we need to test this for hormone deficiency, and what are the reasons why you should not test for hormone deficiency. Regardless of whatever they are, we're going to go over them first. What options are available to replace testosterone or other hormones if that's missing? And why do we have to replace in the first place? What other options are available to us that we can naturally boost our levels if they are low? If they're too high, what can we do to bring it down? I'm sure no woman is going to complain that my husband or my partner has high levels of testosterone. But regardless, if that's the case, what do we do? What are the risk versus benefit of testosterone replacement therapy? This is, of course, is very dear to me because as everybody talks about hormone replacement therapy, there are so many negative things out in the on the web about anything to do with the hormones. For men, for women, it doesn't really matter. When the word hormones comes out, it has a bad stigma that there are a lot of risk involved with doing hormone replacement therapy. So that may be true, might not be true, but on the flip side, what are the benefits? Because you have to, at the end, decide, is this replacement therapy more beneficial to me than the risk involved, or is it the other way around? If it's the other way around, where you have more risk than benefits, then I'll be the first person to tell you that please figure out how to reduce your risk down before you can enjoy the benefits. So we're gonna go over some of those as well. What diet and exercise is most important for men? I'm I'm one of those person that will tell you that if I had to spend 2 hours on exercising every single day, I don't have 2 hours in a day to exercise. So what's the most appropriate exercise for me? If I have to spend an hour to 2 hours in preparing the right types of food, maybe I don't have that time. What do I have to do the bare minimum to get the most amount of benefit? So we're going to go over that as well. And the last thing is that what supplements can I take to achieve optimum health? Because we all want to stay healthy, we all want to live or survive, but who wants to have optimum health? So that's my goal, is to give you ways, ideas that you can achieve that. And if I can answer those 5 questions today to the best of my knowledge, I think we'll be able to help a lot of people uh, get better at what they're there to achieve. So let's go with the next one. Why test for hormone deficiency? This is uh, this is a key, because people do not think, when you ask any man, I said, why do you test for hormone deficiencies? I think I'm okay. And the reason they think that they're okay, because all men can only think about testosterone replacement therapy if they have no erections. And by the way, that's the last thing to go down. It's first thing to come up, but the last thing to go down. It takes about 10 years for the testosterone level to actually drop before the DHT level drops, which is the hormone responsible for impotence, or responsible for erection. So when men think that as long as they have erections, they have no problem with testosterone, uh, think again, because low testosterone levels are associated with increasing abdominal fat. I mean, now we are seeing a 20-year-old kid with testosterone level of 1200 with abdominal fat. Very, very high percentage of their fat is in the abdomen. And with the high levels, a high percentage of the fat in the abdomen, or the visceral fat, is associated with increased risk in cardiovascular disease, diabetes, syndrome S, metabolic disorders, and the list goes on and on about poor eating habits. So that's the first reason that I think that people should be tested, because if you do not test it, you have no idea why you're getting this thing. And of course, you're blaming the foods. That's a partial blame too also. Decreasing testosterone levels is also associated with osteopenia and osteoporosis, silent disease. There is no cure for it. I would rather prevent osteoporosis or osteopenia than to figure out a way to treat it. What better way to do that than to see if hormone deficiency is one of the cause of giving you osteoporosis? Muscle mass, strength are lost with low testosterone level. Of course, some of the guys may recognize that part and say, you know what, I'm not as strong as I used to be before, but I have erections, so I'm okay on testosterone. There's something else is wrong with me. Guess again, this is still the same. If once you've lost a muscle mass, it's turning to fat, there are reasons why your testosterone will turn into fat. And if we can reverse it down, we can have a better testosterone level. But if you're not doing it, and I'll give you some reasons right now, is if you have high insulin levels, if you eat chocolates and candies and high fructose corn syrups, refined carbohydrates, that screams at pancreas to produce more insulin. When you produce more insulin, is hyper your aromatase enzymes gets activated. The aromatase enzyme is responsible for getting testosterone to estrogens. So all these men, whenever they eat high fructose corn syrups or refined carbs or sugars and candies, all those things, they are turning all the testosterone into estrogens, and estrogens holds on into fat cells. So now it tells you that what happened when the testosterone levels gets low. It's not because the testosterone level that your body's not producing it enough. It's just you're converting it into estrogens. Decreased testosterone levels associated with higher fat mass, as I said earlier, reducing muscle mass, forgetfulness. Guys, we only have one side of the brain that's functional to us. And even if that's not functioning, God, I don't know how we can help each other out. So we need our memory, even though we only have half the side of the brain that is fully functional to us. We need that. Loss of memory, poor concentration, insomnia, decrease in well-being. These are all the risk factors associated with when you have low testosterone level. And the last thing is that the low testosterone is not a major cause for impotence, but is essential for erections. The major cause for impotence is DHT, which is the dihydrotestosterone that is a metabolite of testosterone. Again, testosterone is not the hormones strictly for impotence, and that's what I want to make myself very clear. As the reason you test for your hormone deficiency is because it's associated with hypertension, diabetes, syndrome X, hyperlipidemia, decrease in your muscle mass, increase in your fat cells, amotivations, loss of memory, forgetfulness, poor concentration. I mean, the list goes on and on and on. And I'm sure a lot of the guys on this call today already may have some sort of lapses in any of these conditions currently right now, which I think the first thing they should do is find out if testosterone levels are low. That doesn't mean that you're going to treat the levels. That just tells you that the levels are low. The question then becomes is that what do I do for androgen replacement? Testosterone and DHEA are androgens. So if their levels are low, what do I do for replacement? The first question I always ask everybody is, it's very easy to go to a pharmacy or have a doctor prescribe you some of these androgens and go buy it and you're done. That's a very easy way out of a serious issue. The serious issue is that you need to identify what's the cause of low testosterone level. Now, back in the 40s and 50s, the guy's testosterone levels was very high up until the age of 60, 65. Why all of a sudden we have low levels of testosterone in the age of 35-year-old kids now? I consider myself a kid, even though I'm a little bit more than 35, because I was in the same boat a few years ago when I realized that my testosterone level had dropped as well. And that's because of my sedentary lifestyle, all my high stress in my work environment, and traveling all over the country doing presentations all the time. And that high stress has really decreased my testosterone level and gone into estrogen levels. So I had to identify what the cause of the low testosterone is. Now, I'm going a little bit off topic right now because unless you can figure out what that cause is, there's no point giving it a band-aid of giving some topical or intramuscular or whatever the therapy is out there for testosterone replacement therapy. That to me is an easy way out. So identify what the cause is. I'll tell you some of the more common cause of low testosterone levels is pollution. uh, Environmental factors play a big role in reducing testosterone levels. Heavy metal toxicities because your air is filled with lead, mercury, arsenic, cadmium. All this heavy metals can deplete your body's zinc production, and that can in turn reduce your testosterone levels down. So we need to understand exactly what that cause is. Uh, we also need to understand other factors of diet that is changing our testosterone into estrogens, especially any diet that is high in sugar or high in glycemic load, where your body is producing a lot of insulin to compensate for all the sugars that you're eating. So I'll be very careful as to eat any single product that can raise your insulin levels to such an extent that increases your aromatase activity, thereby converting all your testosterone into estrogens. That will be disastrous for us. So look into those diets as well. Um, I have nothing wrong against being a vegan or vegetarian, but if you're vegan or vegetarian and you have high carb intake, that's one of the cause of people that are vegan or vegetarian. They have low testosterone levels because they will convert their testosterone into estrogens. Some of the vegans and vegetarians, they have high protein intakes. They may not have the same problem as the people that they're consuming high carb in the diet. So be careful. But if you do have to replace testosterone, then the choices that we have is DHEA and testosterone. By the way, DHEA is the only hormone in your body that can either go towards testosterone, the down the DHA can metabolize itself to become into testosterone or becoming into estrogen. So you got to be very careful. If your body has sedentary, if you are sedentary lifestyle or you have high carb intake, high glycemic load in your diet, your DHEA is going to convert itself into testosterone. But if you work out, if you have mild exercise on a daily basis, and you have a healthy lifestyle, your DHEA has a better chance of getting into converting itself into testosterone, thereby feeding more testosterone on an ongoing basis. So DHEA, you got to be careful on how you use it. Same thing with testosterone. Testosterone by itself is a fabulous medicine for any male that's out there. The choices that you have are capsules, topical creams and gels, intramuscular injections, intradermal pellets, buccal tablets, and sublingual drops. The choices are endless, but what's right for you is what you got to decide. You know, are you the kind of guy that is afraid of taking shots on a weekly basis? I know I am, but I'm a different breed altogether. Pellets are a great alternative for men. It goes under your skin. It's a surgical procedure. It's a minor surgical procedure that the doctors do in their office, and if it's done correctly, you're good for 3 to 6 months, depending on how the pellets are made. Buccal tablets and sublingual drops are all in your mouth, and I consider themselves the same way as capsules. So there are some side effects based on what you do. Unfortunately, there is not a single perfect system for men. There is none. No matter what you do, if you give topical hormones like creams and gels, or even intradermal pellets, you have very high chances of your testosterone getting converted to DHT, which is dihydrotestosterone. The enzyme that converts testosterone to DHT is called 5-alpha reductase enzyme, and that DHT is responsible for for enlarged prostate in most men. Even though it's benign, but who wants the prostate enlarged because it's difficulty in peeing all every single day. So that's not a good sign either. But high levels of DHT gets the energy, the excitement, the eagerness to do things, the spontaneity, um, all the benefits that you see of testosterone of the aggressive side comes from the DHT. So on that sense, it's a great thing. But too much DHT also causes alopecia. So now that's a downside. Injectables testosterone can increase estradiol levels, and so does intradermal pads can also increase estradiol levels. So what's wrong with the increasing estradiol level? Again, holds onto fat tissue, water retention. Guys cannot hang on to any water. For women, it's a little bit easier because during the menstrual cycle, they retain anywhere from 4 to 5 pounds of water. And as soon as they have their period, they loses that water. Men never retain water, so even a slight water increase in the body, the joint starts hurting and aching, and they have arthritis type symptoms, which is generally because of water retention due to high estradiol levels. So have to be closely monitor that thing. Second thing with this high estradiol level is it can also increase your PSA levels, and if that increases your PSA levels, there's a higher chance of getting prostate cancer. Got to be very careful with not increasing estradiol to a very high levels. Secondly, if you have very high levels of estradiol, guys, if you're gonna watch a movie, you're gonna cry very easily. I don't want that to happen to myself or any of my friends. So estradiol needs to be in proper check. Uh, Oral, buccal, and sublingual preparation may increase serum metabolites. What's wrong with increasing serum metabolites? Serum metabolites, you cannot measure them in the blood or the saliva. You can only measure them in the urine. But there's this metabolites that lingers on in your liver and your bloodstream are active. So you are getting the side effects of all the testosterone replacement therapy, but actually not having any testosterone in your body. So it's the worst thing that can happen to you because you have the side effects but no benefits. I'd rather have the side effects if I get the benefit out of it, but if you have no benefits, only side effects, that's no deal for me. So oral, buccal, sublingual preparation of testosterone, in my philosophy, may not be the best option for most of the men that's out there right there. So that's the androgen replacement therapy that we're talking about. By the way, if you guys have any question, please feel free to write in the chat box. While I'm presenting, I'll be more than happy to take on more questions as well, so that it'll help us move along. So risk versus benefit. This is the key now, right? What are the risks and what are the benefits? We already talked about it. First of all, I want to let you know, 2009, NIH, the National Institute of Health, was doing a trial on testosterone in elderly men, uh, and they had to halt the study down in December 2009. They didn't make a big news about this thing, uh, and I'm not sure. I'm not sure why, but I can tell you a couple of things about the testosterone. They had more cardiovascular disease. There were more cardiovascular disease uh, in testosterone replacement therapy group than in the placebo group. And there are a couple of issues with those. The issues the issues that we had was that the guys were obese to begin with. They had syndrome X problems, so that they have already had high fat content. They already compromised. Second thing is they didn't measure the insulin levels. If they were obese people, they have high insulin levels. Insulin resistance is a problem when you give testosterone replacement therapy, because testosterone will convert itself into estrogens. Second thing is all the patients that were tried were all elderly patients that already had known cardiac disease to begin with. So we had a small issue with those kind of issue with those kind of problem. But regardless, the study was halted, and we had to be careful now. Because of that, I have to be extremely careful as to how we're going to prescribe testosterone to any of my men. Uh, when it comes to testosterone replacement therapy, again, the options are which hormones are you going to give them? The one that increases estradiol levels or the one that increases DHT levels? Either way, option is not good for men. By the way, the question came up on the chat box is that what is the uh, what is the best therapy for men without any side effects? None. None. You have to monitor for the side effects for all testosterone replacement therapy for men, because you are giving them a high doses of testosterone, and unfortunately, for men there is no perfect system. In that sense, I like treating women patients, because for women, you can literally minimize all the side effects by doing appropriate drug therapy, but you cannot do the same thing with men, unfortunately. Uh, the way you do it for men is to prescribe very low dose of testosterone, but when you do that, it's barely enough to get to see all the benefits that you might want to see by giving them testosterone replacement. So my biggest concern is obesity and high insulin levels, increasing aromatase enzyme activity. Because of that, we have issues with testosterone converting into estrogens. So if you are a person that is not careful in your diet, and you like to eat a lot of sugary stuff, even red wine on a daily basis, you may want to consider not taking testosterone. It may not be the best option for you. If you give topical testosterone, you may increase DHT levels, and because of that, you may have alopecia and benign prostatic hyperplasia (BPH), which is just enlarged prostate, but is not prostate cancer. So, unfortunately, no matter what you do, there is no perfect system. On one hand, if you give topical testosterone, you are bound to get bald, and your prostate may be enlarged, but it's benign, so there's nothing to worry about over there. But then aesthetically, you don't look as good as you looked 20 years ago. But on the flip side, if you take shots and pellets and all the other therapies, you have a high chance of getting testosterone into estrogens. Now, prostate enlargements and possibly increase in PSA level, which is uh, prostate-specific antigens, which is when their level starts rising, that's a clear indication of having prostate cancer. So, saying that, which would be the ideal treatment is we don't know. That's something that doctors have to identify based on your history and lifestyle as to what treatment might be the best option for you. So you have the risks. You know what the risks are. On the flip side, you know what the benefits are. The benefits are all because of reversing cardiovascular disease, diabetes, syndrome X, reducing the fat cells, increasing muscle mass, have better sleep, have better well-being, increasing concentration, loss of memory. All those benefits are there, but not without some risks. So you have to weigh both of them out. The next question that comes up to me is diet exercise. Because this is very, I mean, there's so many cookbooks out there about diet and exercises. What you should do, what kind of food is the best diet, what kind of exercise you should be doing all the time. But let me just tell you a couple of things about men. First of all, I don't believe in long distance running for any man because the inflammation that is created when you run for such a long period of time, your body never recovers from it fully, especially when you already have good levels of testosterone. So to me, I I I do prefer high intensity and short duration is probably the best for most men out there because you just bodies just get into the anaerobiasis for a short while, get the benefit of it, and then stop the exercise. That's probably the best options out there. It takes a very short amount of time, and you get the best benefit from that. Mild resistance and or mild weightlifting with multiple reps is also recommended for most men because end of the day, when you have the testosterone levels as high as you would like to have, if you're not building up the muscle mass and supporting this muscle mass, the testosterone will be converted into estrogens, and so sometimes it's not the best thing to have very high levels of testosterone. It's like a youthful age, anyways, because you may not be able to keep up with all the activities you had when you're 20 years of age. So you got to be very mindful as to how you want to keep your testosterone level at what range. Do you want to be a 20-year-old kid again, a 30-year-old, a 40-year-old? At what age will you feel that this is what something I'd like to achieve and maintain it? Achieving is not as hard as to maintaining it. So I can get you a level of a youthful age within a month. But the key is, can you maintain that level for the rest of your life? And if the answer is no, there's no point going there. So the idea is to get to a level that you are able to maintain for the rest of your life. So to me, exercise is important. And I do recommend short durations, high intensity with some mild weightlifting with multiple reps. When it comes to the diet, is very tricky. First of all, standard American diet, which is sad, has nothing that we need to stay healthy and disease free. So if you eat standard American diet, stop it immediately. It has full of omega-6 fatty acids inside, which is absolutely not the best omega-3s for your body. Yes, you don't get arthritis from it because omega-6 helps carb arthritis, but other than that, it gives you heart disease. So it's not the best option for us. For men, the best option that's out there is paleo diet. And I'll tell you what the reasons for the paleo diets are. It's not the same as the Atkins because Atkins was all high in protein and low on carbs. But the paleo is not that. The paleo is proteins and carbs, but it's the composition of the carbs that makes the difference. So paleo diets consists of free range healthy animals, proteins, vegetables, fruits, yams, nuts, and seeds, and any other edible raw foods from nature, but no grains. You cannot eat grains raw. That means you cannot eat grains. Uh, Pretty much anything that you can eat raw, except for the animals, of course, the free range animals, vegetables, fruits, yams, nuts, and seeds, that's the best kind of diet that's out there for most men. You need to have high in protein, low levels of insulin rise when you eat your food. When you can achieve that, your testosterone stays as testosterone and never gets converted into estrogens. So to me, that's the best kind of diet that you can have where you are constantly monitoring your insulin levels to stay stable and not have too high of a level, thereby converting your testosterone into estrogens. The last thing today is supplements. I'm not a big on supplements, even though personally I do take a lot of supplements myself on a daily basis, but I'm very picky as to what supplements I do take and I do not take. So let me just go over basic supplement needs for right now. So if you are taking topical testosterones and you have high levels of DHT in your body, the way you stop it is you give them saw palmetto, you take some saw palmetto, nettle roots, pigeon. You can take some zinc and alpha linolenic acid, which is the flaxseed oils. And by doing that, you can even shrink the prostate down if the prostate is enlarged. By all means, saw palmetto, nettle roots, and pigeon is not my first choice because long long-term treatment of reducing DHT levels, God forbid if you do get prostate cancer, it might be a little bit more aggressive than normally if you do not suppress the DHT levels. So I like to suppress the DHT level long enough to get the benefit, but not for forever. So I'll be very careful as to how I suppress the DHT levels. But if you do the same thing with flaxseed oils and zinc, I think you have a better chance of suppressing the DHT levels and not affecting any kind of prostate cancer issues in the future. So that would be my first choice, even though it's point number two. The second thing is how about if you get high estrogen levels? The first thing I would do is reduce the insulin levels, reduce the insulin loads. Berberine, I love the product berberine. It's 500 milligrams 3 times a day. When they did a study neck to neck with glucophage, which is another diabetic medication, the results were identical when it comes to berberine and glucophage. So I'll rather deal with the nature first and take berberine to reduce my insulin levels down. If the insulin levels are down, then the enzyme, the aromatase enzyme, is slowed down a little bit. If that's slowed down a little bit, chrysin and zinc can help block it. So it's a combination therapy. There's no one product that can do everything in one shot unless you go for pharmaceutical drugs. But when you do that, there's some other side effects that goes along with it as well. So I would prefer to stay with supplements like berberine, zinc, and chrysin to reduce my estrogen levels down, and then monitor them on a regular basis every 3 to 6 months to go for blood tests to see what the levels are. As long as the levels are normal, then you don't have to worry about taking high levels of testosterone either. I'm sorry, excuse me. And the last thing is what are the basic needs for men in general? I'm a big fan of fatty acids. Big fan of fatty acids. So that a good source of fatty acid, which is a combination of all omega threes, the EPA, the DHA, the GLA, uh, all those have to be in a good composition to get the best benefit of it. Because as it is, we do not have much fat on our body, but we need the fat cells. We need fat to support the joints. We need the fats to support our memory and cognition. We need the cholesterol to have a healthy heart. For all those things, a good source of fatty acids is essential for most men. Of course, when you talk about everything else, the basic needs, the multivitamins with minerals, probiotics, antioxidants, those are a great program to do on a daily basis. By far, the most important thing that I would recommend for most men that are in the early ages that have decrease in testosterone levels, especially if you are 30 years of age today and you have low levels of testosterone, I would strongly suggest you do a 21-day detox followed by 6 weeks of restricted diet of a paleo type diet on low on mercury, lead, and arsenic. If we can do that, it's all organic fruits and vegetables. If we can do that, you will see the results in literally 12 weeks. The testosterone level will boost up. So my first take for any man is to go for the cause. Go for the cause. Do not go for the supplements and the medication straight up. See if the heavy metals is causing is reducing testosterone levels. See if I can do some detoxifications for all the heavy metals, pesticides, fertilizers, and all the chemicals from the body, and that may increase the testosterone level. See if I can reduce the insulin levels down, change my diet, do some mild exercise. That might help the testosterone level boost up. And if all of this thing fails, and if you give it 110% effort, then by all means, we are here to help you to get someone a good proper regimen of testosterone for. But the bad thing about testosterone replacement is that once you get on testosterone replacement, you are not going to be able to get off of it because you need to take it for the rest of your life. If you don't, the testosterone level will drop again. It's not going to come back again anyways. So testosterone levels are maintained at a level, and to maintain that level, you need to be taking supplements. But if you do all these treatments for detoxifications, diet, exercise, reducing your insulin loads, if you can do all those things, you can maintain your testosterone levels high enough without taking any supplements. And that would be my first recommendations for most of the people that's out there. So that's what I have to say. So please, I know this was brief. This was a brief 35-minute presentation, but my goal was to get you something really, really basic that you can take it and start doing it right away. So that's where we are at right now. So please, if you have any questions, I welcome you to go ahead and type it in and ask, and we'll be able to send. I'll be able to reply to you right away.
And I see that Jack has indicated that he might have a question. Jack, I'm going to try to unmute you so that you can ask your question. Let's see if this works. Okay, Jack. Let's see if we can hear you ask your question.
Hello, Jack. Are you still there? Okay. Here. I have another question from somebody else. How do I determine my ideal testosterone level? I'm 58 years old. Uh, is this for male or female? Uh, this is for male. So let me ask. Uh,
See, Monique?
Yeah, it is my name. This is my name.
Oh,
oh, it's for male. Okay, perfect. So uh, let for a male for 58 years of age, it all depends on the lifestyle. Okay, the key for any man, the normal range for testosterone in serum is from 280 to about 1100. So 1100, 1200 is a 20-year-old guy that is jumping up and down, doing everything possible, not sleeping at all, and doing everything that he could do manually possible. Uh, but 58-year-old, what is realistic number that you can sustain it? For me, I like to keep it in the sort of a middle range between 550 to 700 if possible. But even then, sometimes that might be too much if you have a sedentary lifestyle. So I'll be very careful as to what levels that I can maintain without without increasing either my DHT levels or my estradiol levels. So the key is not the testosterone. The key is what levels can I comfortably have without increasing my testosterone, without increasing my estradiol levels or DHT levels. So as long as you can maintain healthy levels of estradiol and DHT without doing any supplementation, that's a good testosterone level for you. That's what I would do.
okay. We have another question here. How do you suggest a wife or partner bring up this topic for their husband who does seem to have experienced slowing down in his early 50s? Thank you, Cheryl, for your question. So let's see if we can get to that.
All right. Well, this is a question we get to hear from every physician that's out there. Most of the doctors that the patients, most of the doctors that they see for the male patients are being dragged in by their wives or the significant partners, significant others. And that is not to say that the man is not going to come on their own, but I'll tell you, most men don't think they need testosterone because by the time they realize that they have low testosterone level, it's at least 10 years late because they are managing the testosterone level by one thing. As long as they have erections, they have good sex life, they don't think that they have problem with the low testosterone levels. So in order for you to bring this topic up with your partner, I would suggest that you put this webinar where it's recorded, will be soon on our website, very, very soon will be on our website. You let your partner see this recording and see what he or she, what he thinks about it. Because ultimately, uh, the guys have to be informed, and unfortunately, unless you beat them with this information over the head with a hammer, they're not going to get it. So you got to keep on trying until one of these tricks is going to work on you, and they're going to listen to this webinar again.
Very good. And Jack, I can see that your hand is up. You're trying to, maybe you bumped a mouse. If you do have a question, Jack, we'd love to hear it. Just type it into that chat box on the right of your screen, and we'll get to your question as soon as we can. Okay.
Okay. Can you hear us okay?
We don't have any other questions coming in.
Okay.
If we don't have any other questions, we'll wait just a moment. We would like to thank you again for joining us tonight for this webinar, specifically geared towards men's health and hormone replacement therapy and nutrition. Gave us a lot of good things to think about. Please, if you have other questions that you would like to ask in the future, you can always find us centraldrugsrx.com. Go to our website. There's a contact us page there. You can contact us and we'll get you the answer as soon as we can. Or there's a phone number on our website where you can give us a call and you'll be able to talk to a pharmacist or a nutritionist here on staff, and they would be happy to answer your questions and help you with any health-related question you might have. So again, we thank you very much. When you go to our website, please sign up for our newsletter. Join us on Facebook or follow us on Twitter because we have a lot of information that we like to put out, and on a regular basis, we'd love for you to be able to join us on future webinars or in-store seminars. So thank you again, everyone, for joining us for this Central Drugs webinar. We hope to see you again soon. Good night.
Thank you very much.